An autoimmune disorder called as stiff person syndrome. This stiff person syndrome is a rare autoimmune disorder. It's a neurological disorder in which the patient experiences muscle rigidity and painful muscle spasms which often come and go. And let's look in detail about this stiff person syndrome. Stiff person syndrome. Let's see the very rare autoimmune disorder called as stiff person syndrome. And this condition is earlier called as stiff man syndrome. This condition is a rare autoimmune neurological disorder that most commonly causes muscle stiffness and painful spasms. These painful spasms come and go and can worsen over time. The patient experiences stiffness, that is rigidity, and muscle spasms in his legs and arms. In these patients experiences muscle first become stiff, rigid and cause pain. And this condition, stiff person syndrome, is most commonly seen in case of females than that of males, can occur at any age group. And let's see the types of stiff person syndrome. These are the few types of stiff person syndrome, that is classic stiff person syndrome, SPS variant, and progressive encephalomyelitis with rigidity and myoclonus, that is PERM. PERM is the most severe variant of stiff person syndrome. And this condition, stiff person syndrome, is associated with other autoimmune diseases like vitiligo, pernicious anemia, and celiac disease. And let's see the clinical features seen in these patients. And the clinical features are the muscle stiffness and painful muscle spasms. And these spasms are triggered by unexpected or loud noises, physical touch or stimulation, and also by stressful events. Whenever the patient experiences these triggers, their muscles goes into painful muscle spasms and rigidity. And these patients also develop agoraphobia, that is fear of entering into open or crowded places. And let's see the antibodies which are seen in these patients. The autoantibodies which are seen in these patients are these SPS, that is stiff person syndrome patients, make antibodies against glutamic acid decarboxylase. This glutamic acid decarboxylase plays a very important role in the formation of a neurotransmitter called GABA, that is gamma amino butyric acid, which is an inhibitory neurotransmitter. As there are low levels of GABA, that is inhibitory neurotransmitter, the action of excitatory neurotransmitters will be high, and this is the reason why the patient experiences muscle spasms and rigidity. And let's see the investigations help in the diagnosis of stiff person syndrome. These are the following investigations like antibody blood test and electromyography and even the lumbar puncture. In case of lumbar puncture, when we take the CSF fluid and examine, we can detect the autoantibodies produced. We have seen all the clinical features and also investigation which helps in the diagnosis of stiff person syndrome. Let's look into the treatment plan that is available. There is no permanent cure for the patient that can be offered to the patients of stiff person syndrome. What all we can do is just treating their symptoms. And the drugs which are used in treatment of these symptoms are the benzodiazepines like diazepam, even the baclofen can be tried. And in order to reduce the neuropathic pain, we use pregabalin and gabapentin, and other supportive therapies like massage, physical therapy, heat therapy, hydrotherapy, acupuncture, and all other supportive treatment modalities also can be tried in these patients. Even the IV immunoglobulins also can be tried, but we need to keep it in mind that this condition has no complete cure, and what all we can do is we can just manage the symptoms of the patient. And this is in brief about stiff person syndrome, and thank you for watching.